Well, good afternoon. Yesterday at 9 o'clock in the morning, we opened up the call center with the Quicken operation, and we had 50,000 people on hold in the first half hour. And so I just wanted to talk today about how this is working, what you can expect, and to ask for help from those folks who aren't eligible for an appointment, ask them not to be tying up the phone lines. So we booked our first 2,000 appointments. They're running Wednesday, Thursday, Friday are full. We're into Monday and Tuesday of next week. We are going to keep going until we book 20,000 appointments through Friday, February 5th. The call center hours were 9 a.m. to 6 p.m. We've extended them to 8 p.m. We need the extra 2 hours to make sure that folks can get through, and you know the number by now. I think some people have dialed it so many times, they probably don't need to be reminded, but 313-230-0505. And so I never understood some of the stories that suggested the Detroiters were not going to sign up for the vaccines. So we dealt with this back in March and April. That made it sound like Detroit was going to be hit hard by COVID because the city was incapable of responding. In fact, we responded with national leadership on testing, and we today continue to be about certainly far lower infection rate than the surrounding communities, and we're probably the lowest in the state. And now I think it's going to be clear we're going to lead the way on appointments. But anybody who suggested that Detroiters were not going to call up and get ready for the vaccine clearly did not know the people in the city, and we are very shortly going to be national leaders in vaccination. So here's what happened. If you tried to dial, you almost certainly did not get through. We started the day with 42 Rock Connection operators. That's Dan Gilbert's operation that's handling this. We thought that was going to be enough. We've nearly doubled it today to 76 representatives who are taking our phone calls. So we're dramatically increasing the ability. Here's the way it works. If the wait time to talk to a representative is more than 30 minutes, after you get the message, the phone will just cut you off. It tells you that if you'd stayed on it, it would have been more than 30 minutes. We're going to be booking all the way through Friday. So you can try later today, you can try tomorrow. If they do keep you on the line, it means it's less than 30 minutes. And you're going to have an appointment when you get off. Here's our biggest problem. Nearly half of the people who waited the 30 minutes to talk to the Rock Connections representative wasn't eligible for an appointment. We had people calling for information. Where else can I go get a shot? I'm 65. Why can't I get in? I understand these concerns, but the folks on the phone only have one job: book the 75-year-olds in the city of Detroit into appointments. And so if you sit on that phone for a half an hour, number one, they're not going to be able to help you when they talk to you, but you have knocked one of our elderly neighbors off the phone. And so we're really asking for your support that if you are not eligible for an appointment, please do not call this number. Now, a bunch of the calls came into the mayor's office to tell me, as if I didn't know, that you couldn't get through on the line. And a lot of 65-year-olds who want to know, why did the governor say, if I'm 65, I can get a vaccine, but I can't get one yet? And there is a difference between saying 65-year-olds are eligible and actually having the vaccine. And this has been the problem all along. The federal government has botched this from the beginning. They promised there'd be 20 million vaccines by December 31st, and they got 3 million done. This week, the number of doses the governor was expecting came in half. And so you're hearing it in Oakland County and Wayne County and Macomb County. You're hearing it out of Michigan and Beaumont and Henry Ford, is they're all trying to get ready to line up their 65-year-olds. But I'm going to tell you that we're probably 3 or 4 weeks away of having enough doses that unless you have the kind of luck of a lottery ticket, we're probably only going to see 75-year-olds and teachers and cops getting the lion's share of the vaccinations the next 2 or 3 weeks. That's just the reality where we are. It's not Mark Hackle's fault. It's not Warren Evans' fault. It's not Beaumont Hospital's fault. Everybody is moving as fast as the vaccines show up. So what I would ask right now, though, is if you aren't eligible, please don't dial the telephone. So who is eligible? If you are 75 or older, if you were born in 1945 or earlier, and you live in the city of Detroit, call. We will book your appointment sometime in the next 4 weeks. Our Good Neighbor program, I was really pleased. We had about 250 good neighbors booked yesterday. These were 65 or older who booked with a 75-year-old family member or friend. And so this is the one exception in Detroit, is if you'll be a good neighbor and take a 75-year-old with you to TCF Center, you can be booked. And then the other are K-12 and child care workers. Now, the Detroit Public Schools will be doing their own vaccinations, so DPSCD employees don't need to call us, but you are also eligible. But I would say that 80% plus of the folks we booked yesterday were 75 and older. They are the ones most vulnerable to COVID, and they have to be our highest priorities. Okay. This is going to start tomorrow, and you're going to be seeing a lot of this image, I'm sure, in the coming weeks. And Hakeem Berry's here, who is our Chief Operating Officer, and he's promised us it is going to run smoothly. But to give him a fair start, we only booked 400 tomorrow to give us a chance to work out the bugs. Nobody's tried this before, and so folks are going to drive up and have this experience for the first time. The other thing is, since most of the individuals driving up are over the age of 75, you got a lot of folks who have a lot of chronic health conditions already. So Dr. Dunn or other emergency medical physicians will be on site to be able to respond whether it's the vaccine or just another situation. Then on Thursday, we're going to ramp up to 600. Friday, we're going to ramp up to 800. And then starting next week, we expect to be 1,000 a day. If the vaccine number goes up, we'll increase those bookings. If the vaccine number goes down, we may have to reschedule some folks to another day. But I would rather take the risk on scheduling people and have the vaccines not show up and reschedule them than to do the opposite, not have anybody scheduled, have the vaccine show up, and then they go to other places because Detroit isn't ready to go. I am going to do everything I possibly can to make sure every Detroiter who needs it gets the vaccine as quickly as possible. So we're going out on a little bit of a limb here, booking 20,000 appointments over the next 4 weeks. The governor's doing everything she can to get vaccines, and I was pleased to see that the White House in the last couple hours has indicated they're going to be releasing a lot more out of the warehouses. So I am really hopeful that the vaccine supply will ease up across the country. If you are coming tomorrow, please bring with you your ID. We won't let you in if you aren't really the person who booked. Second, when you get there, we're going to hand you a consent form to fill out. So after you pull in and sit down. So if you bring a pen and then something to write on, a clipboard, a book, something that you can put the consent form on as you sit in the car and fill it out. Bring something with you to write on. And so you will come tomorrow past the former Joe Louis Arena, down along the water, into the TCF Center, and they will wave you in to your place inside the garage. And so when you come into the garage, you'll be put in a parking space. We ask you to turn off the car. There's no need to. There's going to be heaters inside the parking structure. A medical and support team will greet you. Dr. Dunn is going to be there himself tomorrow, along with Hakeem Berry. And you'll get your vaccine. You'll stay for 50 minutes for observation. And the great majority of people have no problem at all. I had my shot 3 weeks ago. I had no effects at all. I had my second shot an hour and a half ago. I had a little bit of a headache this time. That's why you have somebody observing, but it was, as far as I'm concerned, a very minor inconvenience compared to the deadly effect of getting COVID. So some people have a sore arm, some people have some muscle aches. There is a very, very small percentage that have an allergic reaction, and the medical staff will be there with their Benadryl and epinephrine, whatever else is in Dr. Dunn's bag, to make sure that they respond quickly. But you have to stay 50 minutes because we want to make sure that you're okay, you'll get your certification, and you'll leave. If Hakeem Berry does this as well as he's promised, you'll be in and out in under an hour. And we do have a 60-minute guarantee, don't we?
Yes.
All right, so he's ready to go. Okay, couple other things I want to talk about, and then I'm going to turn it over to Denise Fair, but I'm going to go off subject. One is I want to thank Detroit City Council. They today cast one of the most important votes of the year. It probably hasn't garnered any media attention, but it was huge. The Cadillac stamping site on Connor, City Council voted 9-0 to sell to North Point with some incentives. That plant was closed in 1987. It has been sitting there as a huge eyesore for more than 30 years, and we had no way to deal with it. Now, North Point is going to take it down with their own money, and I'm confident we are going to land a auto supplier that will supply the new GM plant, what longtime Detroiters call Poletown, and the next generation will be calling Factory Zero. This vote was so important. The fact that it was 9-0 was a major statement, because you've seen some anti-corporate rhetoric, as if driving businesses out of town and leaving people unemployed is somehow a good social policy. But that Factory Zero, because they're making the electric cars of the future, there are going to be a whole bunch of new supplier plants supplying those electric vehicles. Detroit's going to be competing with communities in southeastern Michigan and across the Midwest. We are going after every single one of those supplier plants. But our competitors in other cities have beautiful industrial parks that are ready to build on tomorrow. We've got sites that have 30-year-old factories that have to be knocked down. And if we don't have the mayor and the council working together, we're going to lose every time. And so to Scott Benson and all the members of the council, I want to say thank you, Nicole Sherrod-Freeman and Kenyatta Bridges, who did the great work. But that is a huge step forward for East Siders on Detroit. And I think in February you're going to see that decades vacant factory start to come down. Two other significant announcements today. I'm really pleased that we have a new chief financial officer, Jay Rising. Jay was the former state treasurer under Jennifer Granholm. He's been the secretary for the cabinet for Governor Whitmer, but most importantly, he was the chief financial officer at the Detroit Medical Center for 8 years. He was the centerpiece of bringing DMC from the verge of bankruptcy to stability. And so he will be starting as our acting CFO next week. And also starting this week is our new director of nursing, Dr. Iris Taylor. And while she may be known to many Detroiters as the recent president of the Detroit School Board, she spent a career at DMC and retired as the president of Detroit Receiving Hospital. This is the year the city of Detroit beats COVID. And that means we need to have the kind of talent that understands the medical side. And so we've been very fortunate to have Hakeem Berry, who came out of DMC, Denise Fair, who was an administrator at the Henry Ford Health System, and now with Jay Rising and Dr. Taylor, I don't think there's any question there's not another city in America that is run by as many people with healthcare and hospital experience. We are going to get away from the days that we can't be with our family, that we can't go to a baseball game, that we can't go to a restaurant, that we can't gather together on the riverfront. We're putting together the team that is going to make sure the city of Detroit comes out of this COVID pandemic faster than any other city in the country, and the addition of Jay Rising and Iris Taylor today is going to help move us in that direction. And so those are the highlights of where we're going, and as always, Denise Fair and the Health Department have been actively going out to our most vulnerable residents and making sure they're being vaccinated. And with that, I'll turn it over to Director Fair.
Thank you, Mr. Mayor.
So yes, we at the health department, we have begun vaccinating our most vulnerable. That is our seniors and those who are experiencing homelessness. So just last Friday, we went to Boulevard Manor Nursing Home and we tested the staff as well as the residents. Starting tomorrow, we have already identified 3 homeless shelters and 4 senior apartment buildings where we will again test the residents as well as the staff. Here's our schedule of where we are going beginning tomorrow. We will be visiting Cass Community Family and Rotating Shelter, Cass House and Cass Scott PSH, Cass Travis PSH and Cass Warming Center. And for our senior apartments, we will be going to Oakman Manor, Vernon Center, Hartford Village, and University Meadows. So if you are experiencing homelessness or if you are living in one of the senior apartments, just know we are coming directly to you. It's really important that we bring the vaccine to you. So you may be on the phone line calling TCF Center, but again, this week, this is where we will be going. Again, I want to ensure that we are working really closely with the state to make sure that the vaccine is available to everyone who wants it. And I'm also really pleased, as the mayor mentioned, to have Dr. Taylor join the Detroit Health Department. She is well respected in the community. She brings a wealth of information as the former CEO of Detroit Receiving Hospital. And as the lead public health nurse for the health department, her role will provide strategic oversight of all of our clinical programs, all of our clinics, managing staff, and I, of course, look forward to working well with her. She started yesterday, has already started, and we met with the senior leadership team this morning, and she has a lot of great ideas that she will bring to the team. So again, looking forward to her commitment to our city, as well as to the Detroit Health Department. And so with that, I will turn it back over to the mayor.
Okay, and so Dr. Dunn is going to be making sure that there is appropriate medical staff at the TCF Center as you pull up, as you're waiting. And Doctor, you want to take a minute to talk to people about what they can expect?
Yeah, so the vaccination site will be set up like any kind of large event. Many of you have been to large events around Detroit where we have been doing medical outreach or testing and things like that. And we will have EMS on standby there. We'll be working with EMS. We have emergency medicine physicians from our local hospitals ready to respond to any emergency because we certainly are aware that people who come there could have medical problems or medical issues, and we want to be ready for those, in addition to the rare event of anyone having a reaction to the vaccine.
All right, and the man of the hour tomorrow is Hakeem Barry. He'll be running TCF. Are you ready to go?
We are all ready to go. Just remember to bring an ID, a pen, something to write on, and please wear a short sleeve shirt.
That will take any questions.
Okay, we'll see if we have questions from reporters in the room, but from reporters who are watching remotely, Corey Williams from the Associated Press wanted to know if you could explain again why the differentiation between the 75-year-olds in Detroit that we're vaccinating as opposed to going down to 65 at this time.
So I talked about that last week, but 1/3 of all of our neighbors that we lost this past year to COVID were over the age of 75. People over 75 who get COVID are far more likely to die than people over 65. People over 65 are more likely to die than people over 55. And so we knew, and I talked about this math before, we have 40,000 people in the city over 75, 100,000 over 65. At 1,000 a day, there was just no way that we can get to everybody. And so we made a decision that our most vulnerable folks will be protected first. And we've offered the opportunity for anybody who's over 65 to be a good neighbor and bring a 75-year-old with them, and you can get to the front of the line. We think that's a reasonable way to go.
Okay, let's see here. We got a couple questions from Christine Ferretti. or one question at least. She was wondering how the supply issues with the vaccine in Michigan impact the city's projections for how many doses can be administered every day and every week.
Yeah, so right now, the governor believes that our 20,000 over 4 weeks is their best guess. Now, Hakeem has a daily inventory chart, which he and I go over first thing every morning, and it looks like that will be okay. If the governor calls us next week and says, hey, the White House has released more, we'll book 30,000 appointments. But if she calls up and says, next week's number just got slashed in half, we may have to take some people and push them back a few days. So what we're trying to do is go with our best information. The last conversation of the day is between Hakeem and the top people in the Whitmer administration on what's your latest information, and then our first conversation every morning is, how many do we schedule based on our information? And we're going to keep doing that, because I want to get every single possible vaccine dose to Detroiters that we can get. And the reality is, whoever is most prepared to give the vaccines will end up getting the larger number of doses.
Okay. Question from Annalise Frank at Cranes. Yesterday, the city released a number at about 1 o'clock in the afternoon of 100,000 calls that came into the call center. Is there an updated number for how many through 8 o'clock last night?
I think they hit 120,000. And that's not necessarily 100,000 different people. A lot of folks called back multiple times because if you were outside the 30-minute queue, you got dropped off and you tried again. So somewhere in the range of 4,000 got all the way through, and nearly half of those weren't even eligible and didn't even want an appointment. They wanted to talk about these issues, which I'm hoping today people will be more respectful. The numbers have been coming in 600-700 an hour today. It's a volume number that I think probably is more manageable.
Okay.
Hi, John Hewitt, WWJ. I had just one question, Mayor, appreciating, as I start, you're Detroit-based, you're all focusing on obviously delivering to city residents. But I'm interested in your opinion when we see Macomb County Executive critical of the state. The governor has been repeatedly critical of the federal government. You mentioned the federal government and holding back distribution today. I'm curious, in this logistical chain, without trying to find political fault, where is it falling short? What needs to happen to get a cadence? And do you see this happening slowly? I mean, I'm interested in the distribution aspect and where we get up and running to what you would want to see, let alone health departments on a local basis not being equipped to handle questions coming their way.
Well, I think the governor and Mark Hackel both have a legitimate point of view in what they have to say. So here's the governor's situation. If she issues a approval for too narrow categories, and these vaccines come in, they don't get distributed. That's what we saw happen in December. They came into the hospitals only for frontline workers, and they didn't get used. So she broadened it to 65-year-olds to make sure there were plenty of people and the vaccines wouldn't go to waste. Your problem is, if you're Mark Hackel or if you're me or if you're Warren Evans, is he's got 250,000 people in Oakland County who qualify under these orders, and he's getting a couple of thousand vaccines a week. And so the counties and the city to some extent have taken the brunt of large numbers of calls. So if the governor cut it too narrowly, she's going to get criticized because vaccines go to waste. If she cuts it too broadly, then the local officials are going to get tons of calls from 65-year-olds asking, why can't I go today? And so that was a decision that she made. I certainly understand Mark Hackel's perspective and that the brunt of the calls fell on him as they did in the other counties. I think the answer is this. I did the Face the Nation interview in November, and they asked me about people not taking vaccines, and I said, you are asking exactly the wrong question. There are going to be far more people in Detroit and in other places in the country who want vaccines, and the federal government has absolutely no distribution plan. You guys are always behind the story. You ought to be looking at why there's not going to be a plan. It took about 6 weeks for to realize that is the case. But 7 days from now, Joe Biden will get sworn in. He has designated Jeff Zients as the person in charge of vaccine distribution. Jeff Zients is my very good friend who I worked with in the Obama administration, and he is brilliant. If I could pick anybody in the country to be in charge of the national distribution plan, it would be Jeff Zients. So I am confident that we're going to be in good hands in a week. I'm guessing mid to late February, you're going to start to see us get to where we need to be. And in the meantime, all of the county officials in the city of Detroit, and you're seeing the same thing out of Michigan and Beaumont and Henry Ford, is they can tell their patients over 65 will put you in a queue, but they actually don't know how many vaccines are coming next week, and so they're going to be reluctant to book people. But I would guess mid to late February, this will seem like it's normal throughout southeastern Michigan. I'm certainly hopeful in Detroit it's going to seem that way sooner than that.
I appreciate that. My last question maybe is for Denise in regard to when you talk seniors in particular, or anybody for that matter, with all these talks about variants and deliverables of vaccines, how do you make sure the second dose is there for everybody on time when they're going to be scheduled to get it? I'm assuming that's allocated or accounted for.
Absolutely. So we have, I believe the mayor mentioned how every day Hakeem is on the call with the state, making sure that we are getting the appropriate allocation. So for example, with Moderna, we received 2,000 doses right before Christmas. We are on schedule to receive that second dose, and we are accurately monitoring to make sure that no one misses their second dose. But again, it really is based upon availability. But again, our conversations with the state have been strong, and I feel really good about the direction that we're heading.
And the last one, I was going to ask you the other day, when you talk about homeless population, is there a transience challenge, for lack of a better way to ask, in regard to going to a shelter, having there, and then they may not be there in 3 weeks, et cetera, in terms of tracking a population?
Yeah, so there is a system called HIMS, H-I-M-S, and that is a tracking system that the city of Detroit has partnered with every shelter in the city of Detroit. And so it is an accurate count. It's an accurate daily updated system. So let's say, for example, we're going to Cass Travis. We'll be able to vaccinate those who are there, and then if they are there 3 weeks later for Moderna, or 4 weeks, or 4 weeks for Moderna or 3 weeks for Pfizer, we'll be able to track them accurately.
Thank you.
Hi, Chris Hall at the Detroit Free Press. I have two questions. What is the city's 75 and older population? And how soon will the city open up to 65 plus, given the allocation estimates?
We have about 40,000 residents of this city, 75 and older. We'll have 20,000 appointments booked by the end of the week. The point at which the 75-year-olds stop filling up the slots 4 and 5 weeks out, we're going to change it to 72-year-olds. Then we're going to change it to 70-year-olds, then 67-year-olds, then 65-year-olds. We're going to keep bringing the ages down as the appointments allow, and I hope that's soon. But if the governor tells us we've got 20,000 vaccines next week, it's going to happen soon. If she tells us we got 5,000 vaccines next week, it's going to be slower, and we're ready to move as fast as the vaccines show up.
Okay, thank you.
Okay, Mayor, on a different topic, the auto show, Detroit News has got a few questions. I want to know when the city found out about the change that was being made, how it will impact the city financially, if we know, and whether or not we're working on any plans for a different type of event in Detroit.
Yeah, so the auto show couldn't go on this year. I think we can all understand that, even though they were talking about the fall. There is no way to book rooms, book hotel rooms, make the kind of massive investments in displays for this September when you don't know what the COVID situation is going to be. So the auto dealers were in a position where it was impossible to hold an auto show this fall. We got that. Then they announced they're doing this thing at the little track out in Pontiac where they usually test the Lamborghinis. And I was okay with that. What I wanted to make sure is, it got characterized in one of the news outlets as if the auto show was moving, and that's not true. But I've talked to Bill Ford, I've talked to Mark Royce, I've talked to Mark Stewart at FCA, and Ford, GM, and FCA have all made an absolutely solid commitment that they will not be supporting anything in Pontiac this year unless there is an unequivocal commitment for the auto show to be back downtown next year. And so it's hard to know what an auto show looks like. The Geneva and Frankfurt shows got canceled. This week is CES, which is the big electronics show in Las Vegas. It's 100% virtual. And so you have a lot of things changing. I understand the position the Detroit Auto Dealers Association was in, but whatever an auto show looks like in 2022, I've got the absolute commitment from the leaders of GM, Ford, and Fiat Chrysler that it will be in the city of Detroit.
Okay, that's our last question.
All right, thank you.